In this figure, you can see ischial tuberosity, tibia and fibula. Okay? This muscle origin from ischial tuberosity attached to tibia. Other attached to posterior surface of tibia, this one, and other attached to fibula. Posterior compartment of thigh has 3 muscles. Posterior compartment of thigh has 3 muscles. From medial to lateral or semi. Posterior compartment of thigh has 3 muscles from medial to lateral or semi-tendinous, semi-membranous, and biceps femoris. Semi-tendinous, semi-membranous, and biceps femoris. Biceps femoris. All of them origin from
ischial
tuberosity. All of them origin from ischial tuberosity. Biceps femoris has a long head and a short head. Long head origin from ischial tuberosity. Short head origin from femur. Which part of the femur? Posterior. Which part? Lina aspera. Lina aspera. Okay? Semi-membranous and semi-tendinous insert to tibia. Semi-tendinous and semi-membranous insert to tibia. Semi-tendinous, medial side, semi-membranous, posterior side. Semi-tendinous, medial surface of tibia, semi-membranous, posterior surface of tibia. And biceps insert to
fibula.
Which part of the fibula?
The head of the
Head.
fibula.
Head of fibula.
Semi-tendinous, I use them with tibia blossa, that they use them with tibia blossa, lateral, or the medial.
This one of
Medial.
medial side, this one is medial side of tibia. Medial side of tibia. Upper part of medial side of tibia attach this muscle. Sartorius. Attach this muscle. Gracilis. And attach this muscle. Semi-tendinous muscle. The medial surface of the tibia upper part of medial surface of tibia is very important because one of anterior muscles is sartorius, attached to this area. One of medial muscles, gracilis, attached to this area. One of posterior muscles, semitendinous, attached this area. Medial, upper part of medial surface of tibia is very important because one muscle from anterior compartment, sartorius. One muscle from medial compartment, gracilis. One muscle from posterior compartment, semitendinous, attach this area.
The anterior one is serratus.
Sartorius. Sartorius. Sartorius from anterior compartment, gracilis from posterior compartment, semitendinous, gracilis medial compartment, semitendinous posterior compartment. All of them are called, all of them,
Oh, semitendinous. Yes, it's the same attachment.
semitendinous and membranous and biceps together is called hamstring muscle. Semitendinous, semimembranous and biceps is called hamstring muscles. Hamstring muscles composed of semitendinous, semimembranous and biceps.
Semitendinous.
All of them origin from ischial. All of them innervate by
Oh, okay. Semimembranous is the posterior surface of the tibia.
all of them innervate by sciatic
Semitendinous. Medial surface, yes.
all of them innervate by sciatic nerve. Sciatic nerve.
What is the name of that in the middle of the triangle?
This one, gracilis. Gracilis from medial compartment.
All of these three muscles innervated by sciatic.
In this figure, you can see ischial tuberosity. Ischial tuberosity is origin for semitendinous, attached to medial side of tibia. Biceps has a long head and short head. Long head from ischial tuberosity, short head from linea aspera, attached to fibula, and semi-membranous origin from ischial tuberosity and insert to posterior surface of the tibia. In this figure, you can see formation of sciatic nerve. Sciatic nerve origin from L4 to S2. All segment of the spinal cord contribute to formation of the sacral plexus, contribute to formation of sciatic nerve. For this, the sciatic nerve is largest peripheral bone. Largest peripheral bone. Peripheral nerve, largest peripheral nerve.
Sciatic nerve.
What is bed of sciatic nerve? What is sciatic nerve bed? From above to below. The sciatic nerve lie on
Gluteus region
gemellus superior and inferior,
and quadratus.
tendon of obturator internus, quadratus, and this area. And this one.
Image string muscle.
Posterior surface of the thigh. Which muscle contribute to bed of the sciatic nerve? All of them are medial of the sciatic nerve. This muscle, this one, this muscle is very important as a muscle of sciatic bed. This muscle attached to adductor tubercle. What is this? This muscle. Adductor magnus. Adductor magnus. The adductor magnus is a muscle of medial compartment, but cover posterior compartment of thigh. And it's very important, because forms main bed for sciatic nerve. Adductor magnus. Okay? What's function of hamstring muscles? What's function of hamstring muscles?
Bending the knee.
Yes. The hamstring muscles cause flexion of knee. Flexion of knee. In addition, help to extension of
Hip.
thigh or hip joint. Hamstring muscle contribute to hip extension and is main
Knee flexion.
flexion.
So, what's the name of the bed of the sciatic nerve, the other muscle, the final one?
From upward to downward, gemellus superior and inferior, tendon of obturator internus, quadratus, and adductor magnus.
Oh, thank you.
Adductor magnus is very important because this one is adductor magnus. Adductor magnus. Adductor magnus has a foramen for passage of femoral artery, from anterior compartment to posterior compartment. This foramen is called femoral hiatus. This foramen is called femoral hiatus. Okay? The adductor magnus has four foramen. The adductor magnus has four foramen. Four. Adductor magnus has four foramen for passage of these arteries.
Foramen in the muscle?
Foramen muscle, yes. For passage of perforating branch of deep femoral artery. This one is deep.
You should mention that before I started to hide.
Artery. I learned the deep femoral artery is a branch of the femoral artery. And deep femoral artery has four perforating branches. Yesterday. Today, we can see passage of these branches. The perforating branches of the deep femoral artery pass through adductor magnus. Adductor magnus. Genital region is very important because there are two important anastomosis. Lower anastomosis is called cruciate. It's called this one. It's called cruciate anastomosis. Cruciate anastomosis. Upper anastomos is at the level of the therefore this is called trochanteric anastomosis. Trochanteric anastomosis. Which arteries Which arteries contribute to formation of cruciate anastomosis? First, perforating. This one. First, perforating artery. First, perforating artery. This one. First, perforating artery. This one is medial and lateral circumflex femoral arteries. Medial and lateral circumflex femoral arteries. Medial and lateral circumflex femoral arteries are branches of deep femoral artery. Are branches of deep femoral artery. This one is called inferior gluteal. Inferior gluteal artery. Inferior gluteal artery. Which arteries contribute to formation of cruciate?
The lateral circumflex femoral artery. Yes.
Medial and lateral circumflex femoral artery.
Not deep.
Medial and lateral circumflex femoral arteries. And inferior gluteal artery. These arteries form cruciate anastomosis. Which artery contribute to formation of trochanteric anastomosis? Inferior gluteal artery and superior gluteal artery, medial and lateral circumflex, medial and lateral circumflex femoral arteries. Medial and lateral circumflex femoral arteries.
The superior one also has femoral name, same name.
Medial and lateral circumflex femoral arteries.
They have the same name as
Yes. Trochanteric anastomosis, the trochanteric anastomosis and the cruciate anastomosis and perforating arteries and perforating arteries and perforating arteries form a anastomosis chain, anastomosis chain in the stable compartment of thigh. The trochanteric anastomosis, the cruciate anastomosis, and perforating arteries form an anastomosis chain in posterior compartment of thigh for communication between gluteal artery, excuse me, pudenda, excuse me, for internal iliac artery and popliteal artery. There is an artery into the pelvis. It's called internal iliac artery. There is an artery in popliteal fossa. It's called popliteal artery. Okay. This anastomose, this chain connect internal iliac artery superiorly to popliteal artery inferiorly for help to blood supply of the thigh. Blood supply of the thigh. Okay. Last topic. 5 minutes. Last topic. Summary of movement of the hip joint. Summary of movement of hip joint.
What? Yes. This one is a cross section of the hip joint. This one is cross section, a transverse section of hip joint. Anterior, I lie here, you cross my right hip joint and see attachment of muscles and movement. Okay? Anterior, posterior, lateral, medial. Anterior compartment of thigh. You can see anterior compartment of thigh. You can see quadriceps, femoris, quadriceps femoris, sartorius, okay, pectineus, iliacus, and psoas, anterior compartment. Many of them are in femoral phalangeal, ilio, psoas, pectineus, okay? All of them are flexor. All of them are flexor of hip joint. All of them are flexor of hip joint. Psoas, iliacus, pectineus, sartorius. Which part of the quadriceps? Rectus head. Rectus head of quadriceps. And all of them are innervated by femoral nerve, except of psoas major. Except of psoas major. Psoas major innervated directly by L2, L3, L4 because psoas major attached to axial skeleton. Okay?
L1, L2, L3, L4.
L2, 3, 4. L2, 3, 4. Direct. Medial compartment. Medial compartment or adductor compartment. You can see adductor longus, adductor brevis, adductor magnus, and gracilis, and pectineus. Okay? All of them, function of all of them is adduction. Function of all of them is adduction. And all of them are innervated by adduction. Adduction. And all of them innervated by obturator. Obturator nerve. Okay?
Yes, yes.
Posterior compartment. Posterior compartment. We can see posterior compartment. We can see gluteus maximus, gluteus maximus, and hamstring muscles. Hamstring muscles are semi-tendinous, semi-membranous, and biceps femoris. All of them are innervated by sciatic nerve, except of gluteus maximus. The gluteus maximus
Inferior
inferior gluteal nerve. Lateral.
So what function is extension?
All of them are extensor. All of them are extensor of deep joint. Okay. Extension. All of them are extensor of deep joint. Lateral compartment, we can see lateral compartment, we can see gluteus
Minimus.
medius, gluteus minimus, and tensor fascia lata, tensor fascia lata, tensor fascia lata attached to iliotibial bone. Okay? All of them innervate by superior gluteal nerve. All of them innervate by superior gluteal nerve. And function of all of them is abduction. Abduction. Okay? Abduction. But if you see this figure, you can see pectineus. Pectineus is hip flexor and hip adductor. pectoralis is hip flexor and hip adductor and has two nerves, femoral nerve and obturator nerve. Okay? Gracilis, excuse me, adductor magnus. Adductor magnus is a part of the medial compartment, but has additional origin and insertion, for this reason is a part of the posterior compartment. Adductor magnus. Adductor magnus has two functions: adduction and extension. For this reason has two nerves: obturator nerve and sciatic nerve. Okay?
Adductor magnus,
Adductor magnus. Okay.
because it's like same in the middle.
Is a part of the medial, but is extend in posterior compartment. For this reason, is a part of the posterior compartment. For this reason, is part in the extensor muscles of the hip.
It's innervated by
Innervated by sciatic nerve and obturator
Or.
nerve. Yes. Pectineus muscle, pectineus muscle, and adductor magnus has two function and two nerve.
function.
Okay?
Doctor, in the anterior compartment, process major innervated by directly L2 and
All of muscle are innervated by femoral nerve, except of Mrs. Major, innervated directly by L2 to L4. Okay?
Yes.
This one is abstract of function and innervation of muscles in the hip joint.
Is there? Just a size.
Doctor, which muscle is? That's one. The first of the middle.
This one, Gluteus medius minimus tensor fascialis.
Medius? That is medius.
Medius.
Medius minimus. This one is maximus, medius minimus. Okay? This one?
Medium.
Excuse me. Lateral. 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 Excuse me. Okay. This one is This one is hip bone. What is this? Acetone. Acetone. And this one? Operator foramen. Operator foramen. This one? Head of femur. Head of femur. And this one? Head of the femur contain ligament of the head of the femur. Ligament of the head of femur attach head to a fossa into the acetabulum. This ligament contains artery for nutrition of the head. This artery is called head artery of head of femur. This artery is called this one. Artery of head of the femur. Okay? This artery is very important for your future work because if this artery is blocked,
Femur dies.
the blood don't nutrient head of the femur. And for this reason, the head is necrosis. The head is dead. Okay? And the head must be replaced by internal fixator. For this reason, this artery is very, very important. Artery of head of the femur. You next session, next week, you must answer me. What is origin of this artery? This artery is branch of which artery? Artery of the head of the femur arises from which artery? Okay? Finish.
Finish for today?
Okay.
Finish for today?
Yes, no, please. Next time we review upper limb.
Yes.